Welcome to The Bee's Knees, a podcast full of articles, interviews, clinical studies, and advice about knee surgery, physical therapy, and life after knee surgery.
Hi everyone, this is Mary Elliott from X10 Knee Recovery System, and today I am going to have a beautiful guest with us that is going to help us learn more about the coronavirus, COVID-19, and knee recovery. You know, how those two go together, how we can protect you moving forward, how we can make you feel safe throughout your whole recovery, whether it's prehab or rehab. The X10 in-home knee system can be a pretty great choice, right, for you. And we're going to discuss why. And Amy, one of our wonderful coaches, is going to introduce herself right now, and then very briefly go over some really good tips and give you some knowledge so that way you can move forward very successfully, okay, and peacefully and safely.
Hi, I'm Amy Bodway. As Mary mentioned, I'm one of the patient coaches here at X10. I'm also a physical therapist, which is a great fit to what I do. Given that the coronavirus is out in our communities and many of us are concerned about exposure, and the great option with the X10 is you can rehab your knee in the safety and the privacy of your own home and limit your exposure, limit your risk.
We're going to talk today here, Amy and I, about how to prevent what the symptoms are for the coronavirus and what your options are, so that way you can take some time and make some really healthy decisions for yourself moving forward. Amy, do we want to talk about what are the steps that a person needs to take to prevent the virus itself?
The prevention is obviously very important. There's currently no vaccine available out there to address the coronavirus, so the best thing you can do for yourself is to not get exposed and just not get sick in the first place. It's important to note that the people at highest risk of having severe complications of the virus are people with chronic medical conditions such as heart or lung disease and diabetes. So if you have any of those conditions, you could talk to your physician about additional steps you can take to protect yourself beyond what we're going to talk about today. One of the biggest things you can do to help prevent your exposure is to wash your hands frequently, regularly, and with proper technique. I recall from my training years ago, one of the commonly missed areas are in the web spaces of our hands. So when you're washing your hands, you want to kind of use your fingers in those spaces and get under your fingernails, making sure you're washing for at least 20 seconds, which is 2 times through the happy birthday song to help you get the guide.
That's fantastic.
Yeah.
What a great thing to remember. And also, we're going to place a link that you can go visit from the Center of Disease Control. They have a video on how to properly wash your hands. So if you really want to get detailed and know inside and out about this issue, we've got you covered.
In addition, if you don't have access to soap and water, hand sanitizer is an option, is an alternative. It's important that you use sanitizer with at least 60% alcohol, though. To do that. If your hands are visibly soiled, sanitizer is not sufficient. You really do need to wash with soap and water. Something else that you can do is just stay away from sick people that you know are sick.
Well, but before you move into that, Amy found a homemade recipe.
Oh, yes, right? Yes, for sanitizer, yes. So often, if you've been shopping out in the community, the shelves are barren. There's no sanitizer out there. So you can make your own solution of sanitizer using a cup of isopropyl alcohol, making sure it's at least 70% alcohol, a half a cup of aloe vera gel, and 15 drops of tea tree oil, which is known to have additional antibacterial properties of itself. So you can mix that together and keep yourselves prepared.
That's great. That's good. That's not even that difficult. Right. All right, perfect. Okay. All right, sorry, I interrupted you.
No, that's okay.
What were you sharing with us?
Avoiding people who are sick, just making sure you stay away. If someone has an illness, whether it's confirmed to be coronavirus or you're not sure, just stay away. You can FaceTime or talk over the phone. If you're sick yourself, make sure that you cover your cough and your sneeze and wash your hands or use sanitizer after. Another way to prevent the spread of the coronavirus is face masks. And it's important to note that those masks are really truly meant only for the people that are ill, to prevent the spread through the droplets as they cough and sneeze. So if you're healthy, you don't need the mask.
Okay, isn't there a 6-foot safety
radius? Yes.
Yes.
Yeah.
Okay, so keep that in mind, right?
Yep.
Okay. So
yeah, the coronavirus is spread through droplets primarily in close contact with people that are sick. So if you do have to go out into the community and there's no option, just keep your distance from people. Those droplets don't spread more than 6 feet, so that's the safe range. Also, making sure that you clean and disinfect frequently touched surfaces often throughout your home with a antimicrobial wipe or a homemade solution. Vinegar is not sufficient to kill for viruses, particularly the coronavirus, so you want to use a solution that is based in diluted bleach or alcohol. The reason that you want to wash your surfaces down is that indirect exposure. The virus is primarily transmitted person to person, but you can have indirect contact. If I was sick and I coughed and I didn't adequately cover, I could get droplets on the table. Mary comes later, touches that, maybe touches her hand, her face, and you can get exposed that way. The virus can live on hard surfaces for a number of hours up to several days. So in your home, wiping down those surfaces is important just to prevent, you may not realize that you touch something in the community, you come home and you touch the light switch and now your family is sick.
Thank you, Amy. Right?
Yeah.
So you're not just protecting yourself, you're protecting all your loved ones too.
Absolutely.
Okay, great. Okay, and then anything else you want to share as far as preventative measures?
Yeah, but just back to the face mask too, because I know that's another resource that is limited supply, just like the sanitizer. So as I mentioned, it's intended for the people that are sick themselves or the caregivers. If you are not sick, it won't protect you. The best thing you can do is to wash your hands and use the sanitizer. The purpose is to stop the droplet from spreading. So if you're not ill, please save the face masks that are out there in the supply for the people that really do need it.
Okay, so now Amy and I do want to educate you too on, what are the symptoms? How do you know, hey, should I be worried about this? Do I have the coronavirus?
The symptoms typically appear between 2 and 14 days after exposure, and it primarily presents with fever, cough, and shortness of breath. That can very general, vague symptoms that can mimic other things. So if you think that you've been exposed or you think that you may be sick with the coronavirus, the best thing you can do is to contact your physician and take their advice on what you should do going forward.
Thank you, Amy. That's great. Great information to know. Okay, so we're keeping you safe here. All right, now the next issue we'd like to cover with you is, all right, how does the coronavirus spread?
Yep. So we mentioned earlier that the main way that the coronavirus spreads is through that droplet transmission, close contact with people that are sick. People are most contagious during the period where they're showing symptoms. Being that this is a new illness, a new virus that's being discovered, we're still learning about it. So there is the possibility that you can be contagious and spread the virus before you start to show symptoms, but that is not believed to be the main mode of transmission. It's when you're actively sick.
Moving forward, the whole intention here for us to do this is to, make you feel safe, right? Healing when you're trying to recover is always body, mind, soul, right? So the more peaceful and centered you are within good, loving, positive thoughts, right, the better healing you're going to incur. So, we want you to continue to have vibrant health, right, and to fill your lives with love and joy, right? That's why you're having knee surgery, right? You want to get back to the things that you love dearly. Keep in mind, everyone, that we have had this system in place for years now, right? And we've been doing it very successfully. Even though the X10 is very user-friendly, we have always assigned all our patients a personal X10 coach. They get very attentive care, and how we do that is, please remember, the machine itself shows your results, right, on the computer screen right in front of you. You always know where you stand and where you're going, how far you're progressing. But not only that, but the X10 has the capacity to text your data every time you get on that machine. Your coach is able to see what's going on with your recovery. So you are getting daily attentive care. How beautiful is that? That's why our patients recover so much faster, right, than other conventional methods. It's because of the daily interaction they get not only with their coach, but they get far more therapy. 3 sessions a day, 7 days a week does make an incredible difference, and they're able to do that because of the patent technology that the X10 has. Right, so this is not something new because of the coronavirus. This is a system we've had in place, and we have been very successful with it.
The in-home visits are minimal with the X10 system too. You have that attentive, frequent contact with your coach, but it's primarily over the phone. We have the data through the system. We see it on the computer in front of us, so we can guide you in your recovery and minimize that potential exposure to the coronavirus or really the flu or anything that's out there.
And let's keep in mind, all right, the X10 machine is delivered to your home, by your setup specialist, and he delivers a disinfected machine, right? This equipment, only you are going to be using this. It's not going to be exposed to anybody else in a clinic, right? Just you are going to be getting on the X10 and getting off the X10. And another layer of safety, right? So that you can feel peaceful about this whole situation and system. Every Friday, I send your surgeon your results, right? So everyone who needs to be in the light of where your progress is currently at, how you're coming along, is you, your coach, your X10 coach, and your surgeon, right? So we really care about you, and we want to keep you safe, and we want you to move forward, experiencing, all those things you've been dreaming about, right? That active lifestyle again, playing with your grandchildren, getting back into sports, less pain. That's what we're here for, right? We're here to help you strengthen those muscles around that knee and also regain your flexibility, right? The two major concerns that you have when you're recovering from knee surgery. So know that we're here for you. We could be placed in your home. We can limit your exposure if that's a main concern for you right now. We've got you covered, okay? We've got you covered. If you're looking for more information regarding the coronavirus and also knee recovery, please check out the description. We will have some links in there that you can easily access for yourself.
The Knee Store. If you're having a knee done, you just may want to share that news with the world. If so, we've got a mug, t-shirt, or awesome tote for that. Visit the Knee Store on cafepress.com. Shop for the perfect item that reflects your feelings about getting back to a full life after a successful knee replacement surgery. Visit cafepress.com/the Knee Store. Great prices, fun and unique stuff.
Sometimes a knee surgery recovery requires more than the conventional. It calls upon the heroic.
I would go into rehab feeling like $1 million, and people would stop me and go, "What knee did you have done?" And I said, "I had both done."
Getting there. Epic tales of knee surgery, recovery, and courage. A new book by P.J. Ewing. Visit gettingtherebooks.com to learn more.
We'd like to thank a few friends of the Bee's Knees podcast, including the Knee Pain Guru, natural solutions for chronic knee pain without drugs, shots, surgery, or painful physical therapy. For more info, visit thekneepainguru.com. We're also brought to you by X10 Therapy. And special thanks to Dr. Justin Trosclair at the podcast, A Doctor's Perspective Podcast.
I'm Dr. Justin Trosclair, host of two-time Podcast Awards nominated A Doctor's Perspective Podcast. I interview doctors in and out of my profession about their specialties and the occasional non-doctor special guests. But we also go behind the curtain and see what's working for their marketing, overcoming struggles, practical knowledge, book choices, and relationship advice. Join me on any podcast app on your phone or visit adoctorsperspective.net for the show notes pages and free resources. I want you to have an abundant home life as well as a thriving practice. So come on, take a listen.
The Bee's Knees podcast comes to you from our studio in Lower Manhattan, New York City. We're here week in and week out shedding light on all aspects of knee surgery and recovery. To reach us, send an email to thebeeskneespodcast@gmail.com.